Welcome back. This is a continuation of the value analysis program, and in this segment, we're going to be talking about communication. Now, I know everybody knows communication is important, but this is more of a how to communicate. And we're going to start off by talking about the language of value analysis and then go into the stakeholder groups and the types of communication that you can use to be more effective in communicating the thoughts and the actions of your value analysis program. And so, first off, the language. Language of value analysis is very much the language of supply chain. And, I'm not going to ask you to go out and get a master's degree in supply chain management in order to understand this, but there are some basic concepts and some language that we use in supply chain that physicians in particular really have to understand, because there's a lot of things being said when we use this language, and if you don't understand what it means, you can get confused very quickly, and not only that, become very ineffective in how you're communicating that to your stakeholder groups. So the first one is volume and market share. And I ran into this very first. I was just starting out in my job, and it was one of the very first meetings we had where we were negotiating over a particular product category, and we had a large vendor in. It was a Fortune 500 company, and they had their top level team in, and we were negotiating. And at some point, I decided to speak up, and I started getting in on the quality. And I said, "Where's the evidence? Can you show me the studies?" And I really was kind of pounding them in that, and they were very polite and nodding and, "Oh, we can get that for you, and we'll look into that," and saying things like that. And there was a break in the meeting, and one of the senior members of their team pulled me aside and he said, "Hey, do you mind if I talk to you for just a second?" And I said, "Yeah, sure. What's up?" He says, "Terry, we understand the whole quality thing and the evidence and stuff like that." He said, "But he goes, I just have to tell you something, and I'm just going to be just say it the way it is." And he said, if we don't hear the words volume and market share come out of your mouth in the first 30 seconds, we just shut you off. We don't listen to you." Remember, we were talking about that whole thing with engagement? Well, guess what? If they don't hear certain things, they become disengaged very quickly. And I was really taken back by first off by the bluntness of it, but I was a little bit shocked that he would say that. I always thought that quality was something that we discussed in these types of negotiations. And they look at it this way. They say, "Well, we think our product's good, so we don't have to go on about what makes it good." And so we have to get to the things that really drive pricing, which is what we're really here to discuss. And for them, it's all about volume and market share. And I ran this by my counterpart in supply chain, and he said, "Yeah, that's pretty much how their world works." And and also the person from the vendor who I was talking to, he said, "Look, I've got a pricing council I have to go talk to, and if I don't use the words volume and market share," he goes, "they're not going to listen to me. And if they don't listen to me, you're not going to get what you want. I'm not going to get what I want. And not only that, but I'm going to look like an idiot standing up in front of pricing council without talking about volume and market share." So I learned that that's a very, very important concept. And you have to find ways of getting that into your language when you're talking to vendors. They really don't listen to you. So one of the ways that I learned how to do this, and I think others have obviously caught on to this one, which is, yes, you can talk about volume and market share, but let's talk about what happens when you lose volume and market share. And that gets to this concept of loss aversion, which is a psychological concept. And that is, we're more engaged when we could lose something that we currently have than gain something that we don't have. And so loss aversion can play into volume and market share. And this is how we were able to use it a lot of times working with physicians. And this is why it's so important to get collaboration with your physicians, because if you can get them to buy in on a strategy and an approach to working in a product category, you can now use this. So if you can go into a negotiation and say, "Look, our physicians are willing to let us walk away from this product that you guys are negotiating on and go to another vendor," that's a huge amount of loss of market share for them and volume, obviously. And so it's a way of negotiating with them. So even though it was kind of blunt and I was a little taken back by it, I learned from it and realized this can be something that's used against me, or it's something I could use as part of the armamentarium that I use when we negotiating over price. So it's something that's a part of the language you have to be aware of. The other one is price point and fair market price. And so, I always think of it this way. This is my example. It made more sense to me to think of it this way because I think it just has a lot more generalization for the regular folks out there who you're trying to communicate with, and that is, think of TrueCar, that online pricing service where you can go in and you put in the type of car you're looking for, the market you're looking in, and what it does is it gives you a spread, the lowest, the high, it gives you the mid-range pricing and what they consider to be a good price for your particular product. Well, as it turns out, it doesn't just happen with TrueCar. It happens with a lot of things out there, and a lot of supply chain, particularly large, sophisticated organizations who have connections with a lot of the companies out there that look at this, can get a very good sense of what a fair market price is for a particular product. And it gives you a range, it gives you a mid-range, and it'll tell you what's a good price. If you're going to sole source, you can probably get a lower end of the price. If you're going to do an all-play strategy, you're probably going to be more like mid-range. If there's something very, very specific about that product that has a certain niche you really, really want for some particular reason, you're probably going to have to pay the higher price. But there's a range of prices that are considered fair market price, and you can negotiate within that. So a lot of times when I was talking about how we knew that one of the vendors was not giving us a fair market price, we knew they were outside of that range, and that's why we're coming pretty hard on them, because we were saying they're not negotiating around a fair market price. And so that's what determines price point. And the price point is just simply the price of a particular product. And it's important to understand those two things, because if you don't, you're not going to be able to understand kind of how negotiations are occurring. And so you may look at it and go like, well, why didn't we just pay them what they wanted? Well, you can't. If you went in buy a car and the car is valued at $20,000, and the salesman says to you, well, we'll only let this car go for $30,000. You're going, I just checked TrueCar. You guys are way outside the fair market price. You're going to walk away because you know that there's probably going to be somebody else out there who can deliver that car or something comparable to it at a much, much better value. And so it's the same thing that's happening in supply chain right now. And so that fair market price actually, most organizations have a pretty good idea of what they should be paying for particular products. And so keep that in mind. So when they say to you, well, ours is the one of a kind, it's like, well, nice time to get a value analysis group together, because if you get a bunch of physicians to look at it and say, nah, it really isn't, it's more like a commodity, then we probably ought to be paying commodity prices for it and not paying the premiums that a lot of times they tack on. So understanding that price point and how to get it within that fair market price and negotiating for that is important for communicating to physicians and making them understand that there really is a somewhat of a science behind how to get it pricing in this particular market. The other thing to remember is there's bulk buys, rebates, and bundling. Bulk buys are just that. You go to a vendor and you say, hey, we'll buy 1,000 of these, but we want 5% off or something like that for bulk buys. And vendors are generally willing to do that a lot of times because most of them are for-profit companies. They typically there's always those quarterly statements and report outs that they need to, the targets and goals that they have to meet. So bulk buys is a nice way for them to do it. So if they could sell 1,000 of anything that fast, then great. They're willing to give you a little bit of a price reduction. Rebates are a little bit different. Rebates are very similar in the sense that you get a discount, but it's over a time period. And so you say at the end of the year, if we buy 1,000 of these over the next year, will you give us a 5% rebate? And they'll look at past usage and they say, okay, that sounds reasonable. We can reduce our price if you can deliver that many by the end of the year. If you can't, then you pay full price. But if you can, you get the rebate based on that. And the last one is bundling. And so a lot of vendors have more than one product, and so they'll bundle with other products. And so, we saw a situation where we were getting a bundled product, and when you unbundled it, at first it looked like a bad price, but when you looked at the total bundle in terms of what it was getting built in with in terms of special pricing for the other things in the bundle, we ultimately ended up having a significant savings. And so bundling is a way for both hospitals, healthcare systems to get better pricing. It's also for a way to organizations to tie you into more than one product. And so they'll do it. They'll give you discounted pricing in bundles in order to accomplish that. So those are terms you have to understand. And so a lot of times, and this is the other thing that drives me crazy about particularly the surgical literature, but I guess all literature medical literature is just confounded with this. And that is that they'll go in and say, well, these are the costs of our, we were looking at a cost in this particular research or something like that. And so those costs are usually pulled right out of your administrative database. They're usually based on what the contract price is, and sometimes that's the high price. It will not include bulk buys. It will not include rebates, and sometimes, very often, will not include the bundling, depending on how the price was set. And so you have to keep that in mind when you read literature out there. When someone says, "Well, this is what our cost was," well, that's your cost minus bulk buys, rebates, and to some degree bundling. So be aware of that, and realize that sometimes what we read in the literature isn't always the most accurate in terms of pricing and costs and things like that. So there are ways of reducing costs. You just have to be aware of it, that these types of concepts work out there, and they're all part of the negotiation. Even though you may read something different in our own literature, this is the real world. In the real world, bulk buys, rebates, and bundling are common practice. So be familiar with those terms. Some other terms you need to know: group purchasing organizations, also known as GPOs, and then local contracting. So, GPOs, there's a number of them out there. I don't want to go through all their names, but these are large organizations that are sort of intermediaries between the vendors and the healthcare organizations. And what they'll do is they'll contract with a number of healthcare organizations to get a large enough purchase, enough scale, and then go back to the vendors and say, we want special pricing if we can deliver on all of these, on this total product volume. And when they do that, if you're part of that GPO, you get that discounted pricing, and so you can build that into your pricing structure. And so that's an enormous advantage for a lot of healthcare organizations. Sometimes, though, I was part of a very large organization. What we found was local contracting actually gave you better pricing, because GPOs are representing multiple hospitals and healthcare systems. They don't always get the very best pricing out there. Sometimes there's hospital systems that are large enough that they can do their own contracting, sometimes referred to as local contracting, and get better pricing than even the GPOs on certain types of products. So you just have to be aware of which one is this a GPO price, and then therefore what tier does it come in, meaning how much scale was brought to the table when they were negotiating that price. And if you can get in a certain tier, you'll get a better price, and another tier you'll get a worse price. But the idea is that all prices are going to be better than what you typically get on your own, unless you have scale in your own organization. Large healthcare systems typically do, and will not uncommonly go to local contracting to get better pricing than what the GPOs can offer. So it's just be aware of what type of pricing structure you're looking at when you're doing that. The other one, I alluded to this before, that sole source, dual source, all play, and cap pricing model. So sole source is just that. You have a number of vendors in a particular space. You go to one vendor and you say, I will give you all of our market share in this particular vendor category or product category, but we want the best price, And so that's a good way of getting really great prices. The only problem with that is if your physicians have a preference for multiple vendors, somebody's not going to be happy when you sole source. So you have to be able to sole source. You want to get a lot of consensus and buy-in from your physician groups before you go out and do sole sourcing. Sometimes you just have to do it. Again, you want to communicate that before you do it. But sole sourcing is a great way to get better pricing. Dual source is pretty close to it. And that is, you have multiple vendors in a particular space, but you're willing to narrow it down to two. And so you go back to your physician group, and this is a good one in value analysis programs. We did this on a number of them, where we went and say, which two would you prefer? And then we do a dual source contract for 90% of the volume of the market share. And so that way you say, what you're doing is you're promising that those two sources for a particular product category will get 90% of your market share. And that leaves you about 10% wiggle room. So sometimes we say, well, there's 2, 3, 4% of some of these other vendors that we would still like to keep. This way it allows you to keep them, but you get really, really good pricing on those that you do the dual sourcing with. And so that's another way to get around in terms of strategy. And then all play and cap pricing models typically go together, which is this idea that you go out there, you look at the fair market price, right? The true car price, and you say, look, I think this looks like to be a fair price for this particular product category. I'm going to do an all play strategy. I'm going to go out there to all of the vendors and say, here's our price. This is what we'll pay for this particular product category. And you all get to either play or you get to all walk away. One of those two. If you all walk away, We're probably going to come back to one or two of you and try to do a sole source or dual source contract. And so, it's a bit of a gamble on everybody's part, because you could either get an all in or all out, or like we discovered, some will, when you have enough vendors, sometimes you'll get one or two vendors who walk away from it, but then they pay the price in terms of market share. And so one of the ways that we would ensure that they were willing to stay at the table is we would say, look, if you're out for the entire term of the contract. So if the contract was 2 years and somebody opted out, we say, if you opt out, you're out for 2 years. You're not going to get back in. Come and talk to us another 2 years when you want to consider coming back into our organization. It was a way of putting some pressure on them to accept the cap pricing model. And remember, they're seeing the same data. They know what's a fair price for their product. They know what the price range is. And so they have some understanding. They realize that you're probably giving them something that's most people would agree is probably a fair price. So cap pricing model is kind of a nice way to get around this whole thing with physicians, where you can say, hey, listen, we are going to work in good faith with them. We're going to try to get them all to come on our contract with us. So it's a good way to get buy-in from physicians, but it's also a good way to get better pricing with your vendors. SKUs, stock keeping units. So you just need to know that term. It's a very common term, not just to supply chain and healthcare, but for supply chain all over the world. Stock keeping units are basically essentially it's a number that's tagged to each and every single product. So even if you have syringes, you don't get one number. You have a number for the 3cc syringe, a number for a 5cc syringe, a number for a 10cc syringe, etc. So it's the number of SKUs, stock keeping units you have. And just another FYI for stock keeping units, giving some idea of the volume of stock keeping units. You go into your average grocery store, they typically will manage about 30 to 40,000 SKUs, stock keeping units, for the average grocery store. So when you go walking in an average grocery store and you're looking around, you're going, man, there's just aisles and aisles of all these different groceries or items that I can choose from. And not only that, but they have to keep track of expiration dates. They have to keep track of pricing. They have to keep track of discounts. All of that stuff has to be managed. So 30, 40,000. That's what they do for a living, though. So they're pretty good at it. And it's really unusual for them to have a stock out where you walk in. And usually, if they do, they offer you some sort of deal. Well, hospitals, it changes. It changes on scale. So remember, 30, 40,000 average grocery store. In our organization, we had 166,000 SKUs that we manage on a daily basis. Our supply chain services manage, and so they had to manage all of the expiration dates. They had to manage anytime there was a recall. They had to find stuff to replace things. They had to keep stock shelves full. They had to make sure that they always had something available when it was needed. Incredible amount of work. So the complexity of this not only quadruples, or it's much more than you would see in most types of supply chains. So just kind of keep that in the back of your mind in terms of what they're managing out there on a daily basis. It's very complicated. Your supply chain services is doing it most likely an outstanding job of doing that. And they're professionals at it, so just remember that. And so that's my story behind the SKUs, but it really is one of those eye-openers when you begin to realize what's being managed out there. And then physician preference items. Physician preference items, everybody thinks it's everything. It really isn't. It's a small group of items out there that it's just, as the name suggests, it's things that physicians prefer. It might be a particular type of orthopedic implant, or it may have to be a particular type of pacemaker that a cardiologist likes to use, or it may have to do with a particular type of mesh that a surgeon likes to use. But what happens is they develop some brand loyalty. Not only that, but they might have very good reasons for their preference, meaning there's evidence to support that should be the preferred item, or not only preferred, but recommended item. And so they get very loyal to that. And whenever you start having negotiations around PPIs or physician preference items, things get a little dicey. And that's generally where you want to focus your value analysis teams on, physician preference, because there's a lot of opportunity in PPIs. You should take advantage of it. And not only that, but now that you know about the whole thing of looking at usage lists, you know who's using them and who has brand loyalty. Bring them in on the conversation. You'd be surprised. They're more than willing to give you their opinion about each of these items. But when you get a group of physicians together who had differing opinions, they now have to negotiate over who has the best evidence to support a particular item over another, or why they should want to use one over another. So it's always good to keep that in the back of your mind, but you have to understand that this is an important piece of supply item, and this is for a physician leader and supply chain and value analysis programs. This is the one that's going to consume a large amount of your time. So stakeholders, obviously your value analysis committee, they're probably your biggest stakeholder because it's where you have representation of the entire value analysis program. Your medical staff, they're going to have and I would say also, the leadership as well, because medical staff typically elects their leadership, and so leadership is going to be very dependent on what their medical staff is saying. And so those groups are going to want to know what's going on in your value analysis program. And I'll explain to you a way how we can communicate with them in particular, but keep in mind that that's probably going to be a big one for you. Your C-suite and senior management, they have to know what's going on, particularly if it's going to impact and get medical staff or clinical staff upset. Give them a warning, let them know it's coming. Nursing and ancillary staff, obviously, any change in supplies can impact clinical practice on a regular basis, even for commodity items. So you have to have a way of communicating that to your nursing and ancillary staff. And then the last one is the vendors. And I mentioned this before because I've so far been sort of painting them as kind of like the evil empire out there, but we need vendors and they need us, and it's a business, and it's just the reality of it. And so our vendors are really our friends in many ways, because they're the ones who are bringing us the products that help us take care of help us take care of patients and provide good care. So we have to develop and maintain those relationships over time, and the best way to do it is with communication. I don't advocate having value analysis as some sort of secret program. Let your vendors know we have a value analysis program. Typically they want to be at the meetings. They want to know who's on the meetings, but I wouldn't recommend giving that up just yet. But I think it's important that they're aware that you have a value analysis program and what the findings of a value analysis team are. They need to get that feedback on their products. So the committee, it's probably two things for communication in the committee. The two things that are most obvious are the agenda and the minutes. And the agenda is a forward-looking document, describes what you'll be addressing, what you're going to talk about, what you're going to be developing projects around. Have an agenda, and I'll show you an example of one, but it's just you need to have an agenda out there. You need to keep track of it. You need to be updating it and changing it and making your members aware of it. It's a great way of documenting what you're going to be looking at. Minutes is a backward-looking document. It describes what was discussed and found important enough to put in writing, and then there's really a way to do that in a way that they actually get read, but you have to remember that you're sort of memorializing this for eternity, so to speak, and a year from now, 2 years, 5 years from now, that people may not understand why you were making the decisions you were making. It's good to have it down in the minutes, what was driving a particular decision, so that others in the future have that information and they can make more informed decisions in the future. So here's an example of a meeting agenda. And you'll see I'm a real stickler for certain things, and one of them is I do like to have the purpose up there. And so you can see I put the purpose of this committee is to identify the most cost-effective supply solution. The reason is it's a reminder to everybody why you're there. How many times you've been sitting at a meeting and somebody walks in, they start telling some story about their drive in. The next thing you know, it's 15 minutes. This is a good time that when something like that happens, for one of your leaders of the meeting to step up and say, hey, wait a second, let's kind of focus on what we're here for tonight. It gets everybody reoriented, and you don't get distracted. And you really get your work done. And not only that, but it makes a more engaging meeting. I like to make sure that people know where it's at, when it's occurring. I like people to have a call-in number if you can. It's always nice to be able to telecommunicate. There are times when you just can't make a meeting in person, and you want to be able to call in and find out what's going on. You want to know who's there. You want to know if you're having any guests and what they're doing there. You want to inform people if there's any prep needed for the meeting, because you're going to send this out at least a week in advance of the meeting so people could look at it and go, oh, wow, they want me to read this thing here. They want me to bring some performance improvement goals to the meeting, and that's important to have. You also want to be able to track, action items from the previous meeting, who's a responsible member, and then any due dates. Always put due dates on stuff. It's amazing how things get done when they have a due date and how they tend to get put off if they don't. So always have one on there. Also look at the agenda items, the presenter, the time allotted. Stick to your time allotted. It's really important to do that to maintain engagement. Nothing worse than having somebody come in and give a presentation, and they're allotted 5-10 minutes, and next thing you know it's 30 minutes later and you're still talking about it, and everybody who's looking at further items down the agenda list are sitting there going, we're never going to get to that, or we're going to have our meeting's going to have to go over our allotted time. Try to stick to your meeting agenda time allotments, and when you can't, simply just turn to the group and say, hey, it looks like we're going to go over about 5 or 10 minutes. Is that okay with everybody? If it's okay with everyone, what can we take off of our agenda that we can defer to the next time? Because you want to make them informed that something's going to come off. You've got to be able to manage that time in a very, very assertive fashion, because if you don't, the time will take over, and next thing you know, you're running over a half hour, and nobody can understand why nobody ever wants to come back to another one of your meetings. It's like, start on time, end on time. Make sure you stick to your agenda. That's how you get engagement. We talked about don't disengage people. One of the ways you can disengage them is to get off the agenda and start going outside of your time allotment. Remember, people have other things happening in their life, and if you think, I'm just going to let the meeting go over at the end of the meeting, remember, people want to get back to their families or back to their practice or whatever it is. They don't have all the time in the world to be sitting there in a meeting listening to somebody go on and on about something that just doesn't mean anything to them. So just remember to keep that coordination of your agenda with what you actually do, because that'll create engagement for your members. And then also put on, I think this is a great idea, put on new action items, and that ask people for if they have any ideas. Just say, hey, anybody have any ideas for our next meeting? Is there anything you think we need to discuss? And that's a good way of getting buy-in from membership and engagement, because now they feel like they can make contributions and start to look at it. Now, these are just examples that you see that I put into these agenda items, but feel free to use them or come up with your own, obviously. And then also have the next meeting when it's scheduled, and then the location and time. You want people to be able to plan their lives. And I usually just say, look, set up your meeting schedule at least a year in advance, and then that way people can now become depend on you for when that's always going to be. They don't have to start saying, well, when's it going to be this month? Is it going to be at the same place? And always have it the same place, the same time, and put it out like a year in advance. It's a great way to do it. Plus, you reserve the room, and you get access to the room that you want to have for your meeting. So, here's an example of some meeting minutes. Again, it sort of has all that information I just talked about. It talks about the discussion. I also put in here a thing for ask people for any conflicts of interest. And the reason this is really important in value analysis is you want to make sure that if someone's in there and they have some interest in a particular organization, maybe they're a speaker for them, they do consulting or something like that, you want that to be known to the rest of the committee meeting members, because it keeps them informed, and so that if it's beginning to sound like you're throwing a sales pitch at them, they're going to want to know, wait, are you getting paid by this company for this, or what's your relationship with them? It's just it's a professional thing to do, and I think that in value analysis you really have to do it. Here's just a continuation of that same agenda, and this is just a sample agenda for what might be one of your first few meetings or something like that. But it gives you an idea of sort of the things that are discussed and how much time and what people were discussing, and then when things didn't work out, what did they do? How did they manage that? And so it's always important to be able to put that down into a document. And you want a document that's going to be read, that someone could just go in very quickly and go, okay, I see what happened at that last meeting, and that it makes it easier, obviously, to approve minutes when you're willing to read them, but you feel like you're getting informed by reading them. Plus, if you hadn't been to a meeting in a while, now all of a sudden, if you missed the last meeting, you can very quickly look at the meeting minutes and see what happened there. You don't want meeting minutes that don't have a lot of information. Nobody cares about those, and you don't want one that has too much information, because no one's going to read them. Particularly if it's a bunch of garbage in there, it doesn't really communicate anything. Focus on the stuff that needs to be communicated in your meeting minutes. Think about in terms of 5 years from now, if somebody was looking back on this, would they understand what was discussed at this meeting based on the information in the meeting minutes? If the answer to that is yes, then you've got a great meeting minutes, and you should keep it that way. So stakeholder group, medical staff. I put in here utilize medical staff services. And I'll tell you, everything I've learned about managing physician meetings, I learned in medical staff services. They are the experts. That's what they do for a living. They coordinate and organize and set up medical staff meetings. They work with physicians on a regular basis. They understand physicians. Tap into this group when you want to organize. If you don't have somebody who understands how to get a group of physicians together, go to your medical staff services. They're experts at it. They know how to do this. And one of the ways I worked with them was I said, I want to get information out to our medical staff. And I said, can you give me the emails of our medical staff? And they looked at me and said, no. I said, why not? And they said, because that's private information. We don't give that out to anybody. And said, plus they said, and not only that, but you have to remember that information changes on a regular basis. So that means you're going to be responsible for having to update it. We do a much better job of it, so we would rather do it that way. And I said, okay, well, how about if I if I just send it to you? And they said, well, what are you going to send? I said, how about a newsletter? And I'll tell you who I would like it forwarded to. And if it's for everybody, you can send it to everybody. And if it's not, and then medical staff can decide if they want to read it or not. And they said, that'll work. So I work with them. I distribute everything through our medical staff services. I found that to be a very effective way of getting information out to medical staff. So here's an example. Excuse me. This is a newsletter. I just put together one. It's a mock newsletter, but it basically gets into talking about value analysis and the committee and the goals and things like that. But it's a way of communicating, and it's a one-page letter. Each of the headlines talks about a specific issue in value analysis, and then I bold any areas that I think are really important that people can do. So what it does, it allows them to kind of look at, did I want to know about goals? I do, okay. And I can quickly look at that. In less than 30 seconds, I have an idea of what the value analysis program goals are, and so this keeps me informed. I don't have to spend a lot of time going into a lot of detail, and if I do, one of the things I can do is I can take this newsletter and I can have a link and link them to a source that can give them a lot more detail in one particular area. That way it puts them in control. They get informed. It's very easy to read. They can read this in no time. Not only that, but if they want more additional information, we can have links to that additional information. Or if they want to get back to me and I put my email on there, they can contact me straight through that email. Not only that, but I also put my picture there. The reason is because I want people to know who I am. I want them to have a name and a face. And it's important to develop your credibility that way, to make sure that you're constantly getting that type of exposure with your medical staff. Communication is important, obviously, to the C-suite. It's got to be a consistent message. So I would just include them in on the list for my newsletter. And it was the exact same information. I want them to see what their medical staff are getting so that they're coordinating. Believe it or not, they talk on a regular basis. So you don't want your C-suite getting surprised. You don't want your medical staff getting surprised. And you don't want one going to the other one going, I didn't hear about this, Well, if you're reading the same newsletter I am, that's where I get my information. Same thing with nursing and ancillary staff. It's really good to use the existing channels. That the process they have in place is generally the one that works at your facility. You're typically run by your chief nursing officer, so obviously include them in on your communications. But you don't want to start with your nursing directors. And if you have a value analysis coordinator, obviously that's the person who's going to be able to do a lot of this coordinating for you. So it's important to communicate with nursing and ancillary staff, and particularly on the issues that are going to be important to them. And then the vendors, I think to coordinate this with your contract calendar, and we'll talk about the contract calendar a little bit later, but it's this idea that contracts come up on a regular basis, and you're going to want to inform your vendors whenever something's going out to value analysis. It puts them on notice. Value analysis is looking at something and trying to figure out if it's really worth it to keep a particular product or keep it at the particular price point that you've chosen. So it's important to do that. It's also good to have a spokesperson to represent the program. I think that should be your medical director. If you have a medical director, your value analysis program. If not, and you have a value analysis coordinator, it would be that person who's that spokesperson. But either way, the vendors know that there's somebody who they can talk to if they want maybe some information. And a lot of times it's usually marketing information, so it's okay. I usually say, yeah, sure, send it to me. But if it was just marketing information, not really adding any value to the conversation, I leave it up to the committee to decide if they wanted to view it. Most of the times it was just marketing information they didn't. But if it was a study, they'd be willing to look at and include that as part of their literature review of a particular product. So it's important to be able to keep them in the loop. So again, if you have any questions, feel free to contact me. You can also visit my website. And just as an aside, you saw that I had some example of an agenda and of meeting minutes. Well, I've also put together a startup kit. So there's a value analysis program startup kit. It includes copies of that, and along with a bunch of other information. And whenever I get to that point in the presentation, and I'll make a point to say that's included in the startup kit, and that way you can have access to that stuff. So if you're starting up a program, you automatically have an agenda. You already have a set of minutes that you can start to fill in with your own meeting minutes. So it's kind of nice. And so all you have to do is just send me an email to terryloftusmd@gmail.com. And what I'll do is I'll send you the startup kit. It comes in a zip drive. You just open it up and you'll have all the documents, and you'll be able to use that in starting up your program. So with that, have a great day, and we'll move on to the next session. Thank you.